I think it might be surprising to people how much stigma exists in the mental health field about getting treatment, and in healthcare workers especially. We should be a field that is open and honest about these things, and we have some of the worst stigma. We worry about how it's going to affect our future career, whether patients are going to judge us for it, whether our colleagues are going to judge us for it, whether it's going to affect our licensing, and all of that affects whether we get care, even in the most serious moments in our life. And so I think as healthcare workers, it's really important that we put ourselves first and realize that we need to take care of ourselves. We need to get help because it makes us better at our job. It makes us better family members. It makes us better peers. And it's not a weakness to ask for help. It's a strength. And it's something that we need to think about that way, as opposed to this is not something healthcare workers do. It should be a priority for us instead. Stigma is a big reason that people don't get care. In the two populations I see, there are different reasons that there's stigma, but in the entire population in this country, I think we think about stigma. It comes from media, it comes from television, it comes from movies. People who watch television see people who have mental illness have violent behaviors and think, oh, I don't want to be that person. I don't want to be associated with someone who might be violent. Why would I tell my friends and family that I have mental illness? It's also very culturally embedded, and there are different thoughts in different cultures. But the best way to be breaking down stigma is, first of all, talking about it. And we need to talk about it in all levels, like in our families, in our teams on medicine, in our, entire populations on social media. We need to have people who are like, people we look up to, like celebrities or famous doctors and healthcare workers, actually talking about their experiences too, because having people like that break it down, it makes it also easier because they have the ability with their platform to access more people and say, this is normal, I'm struggling too. And that can be one way to do it. I think from the stories that we make in the media and the stories that we print in the media, it's important to be thinking about how that might be contributing to mental health stigma and how to change that. Like, how can I reframe this in a better way? What resources should I be providing? Is this in any way, because of the picture, because of the words I use, because of how I'm portraying a person, contributing to the way that people think about people with mental illness, taking that into account in every way that we're, printing things. It's very hard to know like how to fix that at every level, but it's important that it's something that we talk about. It's something that mental health is included in every conversation. I think in part because of insurance companies, mental health is so often separate from physical health, so often separate from every other policy. But in so many ways, every policy affects mental health. Social systems affect mental health. Vaccinations affect mental health. Like sleep affects mental health, like climate change affects mental health. And there's data for all of this, right? So not having mental health professionals in the room and not having people that know what they're talking about as like experts is also bad, because I think we're just assuming that mental health isn't related to all of these things and keeping it separate. And it's important to integrate it where it should be integrated, and also important to say like, we need to be changing the mental health system. We need to be helping people now. Was a problem before COVID. It's compounded by COVID. It's going to be worse after. We need to address it before it becomes a really, really serious crisis in this country. And it probably already is pretty close to that, but it's important that we invest in it and we build sustainable systems that can fix it.